Another bit of work that we highlighted that we haven't yet highlighted in this interview is around the diversion of medications inside of jails and to what extent is that perceived to be happening. So based on data we collect in the early days of implementation of this program, we heard from staff working inside the jails around their concerns, like diversion is a reality. And, it was maybe though not as common as they had thought it might be. And they attributed that at the time to the protocols they had developed to provide medications in a way that really reduced the chance of people diverting their medication to others who should not have it inside the facilities.
We've spent a lot of time trying to figure out what the right amount of diversion is for this program. And really, at the end of the day, we don't know what the answer is for us. But, one of the things that has happened is that we've moved away from using diversion as a reason to remove somebody from the program. One of the things we realize, and maybe that's because of this, the stigma associated with MOUD, is that folks will try to divert it because they want to use it for themselves or they want to try and get something out of it, when in fact there's a lot of other reasons why somebody may attempt to divert. And I think part of what we're hoping to learn from this project is how do we better understand why diversion happens? Is it for self-treatment? Is it for the dosing is off and there's more conversations that need to take place between the medical provider and the patient? Or is it because there's security reasons for why it's happening? Is it because there's an individual in the jail who's trying to run up their canteen or commissary account and is using security or threats to trying to make that happen? So these are all things that we, as jail administrators or folks that work inside of jails, have to think about. It's not something that I think that a lot of the community thinks about as far as MOUD is concerned. But it's in order to effectively run a jail or prison, and in order to have access to these types of resources and provide access to these resources to the inmate population or to the incarcerated population, we need to be able to answer these questions.